How do cytotechnologists identify bladder issues in urine? Imagine a tiny detective working behind the scenes to find clues about your bladder health. That's what cytotechnologists do when they examine urine samples to spot potential problems like bladder cancer. The process starts when a healthcare provider collects a urine sample from you, usually a clean catch sample. In the laboratory, the sample is spun in a device called a centrifuge, which uses rapid spinning to concentrate the cells from the urine. This step helps gather enough cells to analyze under a microscope. Once the cells are concentrated, they are carefully placed onto glass slides. These slides are then stained with special dyes that highlight different parts of the cells, making abnormalities easier to see. The staining process is crucial because it enhances the contrast of cellular features, such as the shape, size, and structure of the cells. Under the microscope, cytotechnologists look for signs that could indicate issues with the bladder. They examine the cells for irregularities like enlarged or misshapen nuclei, uneven cell borders, or changes in the cytoplasm. These features can suggest the presence of abnormal or cancerous cells. If they find cells that look suspicious, they mark them for further review by a pathologist, who will confirm whether these cells are malignant or benign. Urine cytology is especially good at detecting high-grade bladder cancers and flat lesions that might not be visible through other methods like cystoscopy. However, it has some limitations. It is less sensitive for detecting low-grade tumors or early-stage cancers, which means it might miss some cases. Factors like low cellularity in the sample, contamination, or poor preservation can also affect the accuracy of the results. Because of these limitations, urine cytology is often used alongside other diagnostic tests such as cystoscopy, urine analysis, and molecular tests. Combining these methods provides a more complete picture of your bladder health. It's important to remember that interpreting urine cytology requires experience and careful judgment, as false positives or negatives can occur. In summary, cytotechnologists identify bladder issues in urine by concentrating the cells, staining them to reveal details, and then examining them under a microscope for abnormal features. This non-invasive test plays a key role in detecting bladder cancer early, but it is part of a broader diagnostic approach. Always consult healthcare professionals for personalized advice and further testing if needed.